Hello guys, this is Dr. T, and I welcome you to Clinical Medicine with Dr. T. So guys, we are covering psychiatry, and we've been I'm sure you've noticed that I've been uploading a lot of videos on psychiatry. So but someone who is doing PEDS has just asked me to do a video on it's an intern that is doing, they just started their PEDS apparently last week. So he just asked me to do fluid resuscitation in pediatrics. So that's what we're gonna do. But yes, I will go back to psychiatry. But if someone asks, like I said, if someone asks a specific topic, I will consider doing it. And yeah, that's why we're here. So guys, this is a very, very, very important topic. It's a very, very complex topic as well, and I will tell you why it's very complex. It's one thing that we really need to push, we really need to know, we really need to try by all means to have it on our fingertips. You know, my skill of assessing a dehydrated kiddie and doing fluid resuscitation, I learned it a lot. I got to appreciate it more, and I learned it and I developed it. It developed a lot when I was doing family medicine in the district. Remember, as interns, our training, when we do FemMed, for those who don't know, when we do FemMed, for 3 months, you're going to go to a district hospital. And in a district hospital, you'd see everything. You see everything, and they can send you. I mean, I did 3 weeks in PEDS. I did 3 weeks in male ward, medical ward. I did 3 weeks in maternity. I did 3 weeks in female medical ward. But in the districts, most districts, they don't have medical or surgical ward. They just put everyone together. So I learned a lot there, and going there helped me a lot. It really, really helped me a lot, because it's easy in the district to make a management plan, and it's easy to follow it up, because walking from one ward to another to check up on your patient is literally a couple of minutes, unlike in other places where you wanna go, you think, okay, I wanna go and see that patient and see how the kid is doing, but because the distance, you are far, and you are also very tired, and you are also overworked. Unlike in the districts, the wards are very close to each other, and obviously they don't work in departments there. When you are on call, you're gonna be seeing the whole hospital, and no. So yes guys, so let's do fluid resuscitation in PEDS, and this will be in relation to, okay, let's do it this way. Let's talk about the fluid compartment. The fluid compartments that we have the extravascular fluid compartment, and we have the intravascular these are fluid compartments. They are full of fluids and electrolytes. Not just water, but also electrolytes. So which means when you lose fluid, you don't lose water only, you also lose electrolytes. So the intravascular, as it says, this is fluid that is inside the vessels. This is the circulating fluid inside the vessels. This is the fluid that maintains our blood pressure. It maintains our pulse. Hence, when we lose intravascular volume, significant amounts, we start to get changes here in these two guys. Because, like I said, your BP, your intravascular fluid, intravascular volume maintains the blood pressure and maintains the pulse. Extravascular fluid, there are two types. There is an interstitial fluid, and then there is intracellular. Right? So there are medical conditions that makes us to lose these fluids, and let's restrict everything to pediatrics because we're talking about peds here. So the manner in which the kiddies lose fluids is through vomiting alone, diarrhea alone, or diarrhea and vomiting. Yes, excessive sweating can cause dehydration, but depends where you are, what part of the country are you. Like in African countries up there close to the equator, it's very hot. You can lose a lot of water through your skin. So the reason why I say vomiting alone, I don't want to give an impression, because for some people it's hard to really believe that vomiting alone can cause dehydration and even shock. Yes, it can. It can. Remember, once a kid vomits, they are not eating, they're not drinking, so their maintenance fluid is like zero, but so there's nothing replacing what they are losing. They are vomiting. On top of vomiting, they're not taking anything by mouth. So what I'm trying to put here is that never underestimate vomiting. Even if it's vomiting alone, never think that vomiting alone cannot really cause problems for the kiddie. Let me discharge this kiddie. The fact that they don't take anything, they're not taking anything orally, water or food, but they continue to vomit, it's actually continuous vomiting in a kiddie is a reason to admit. That's how important vomiting is. So these are the most common causes. These are the most common causes of fluid loss in pediatrics. So now, where's my brown marker? Guys, did any of you take my brown marker? Here's it. Okay. So when you lose fluids, when you start to lose dehydration Dehydration, whether it's mild, whatever you call it, mild, moderate, severe, as long as it's just dehydration, this is extravascular fluid loss. This is extravascular fluid loss. Remember, when you have a cell like that, these cells, their pressure, I think it's called Tega pressure, the pressure that makes these walls to be far apart, to be like that, to be far apart like that, is, I think it's called Tega pressure. You can correct me, guys, if I'm making a mistake. And that Tega pressure is because of the fluid that is inside there. So if this fluid inside this cell would start to seep out, this cell would collapse and become something like this. So to maintain the pressure of this cell, you need that fluid inside there. And in order for this fluid to stay inside of this cell, it means that the fluid that is around this cell must have equal electrolytes, the same kinds and same, more or less the same amount of electrolytes. Because remember, when you have a cell like that, you put that cell inside water, pure water, and here you've got electrolytes. What is going to happen is that the water that is in the so what is going to happen is that if you have pure water but inside the cell, let's say this is the dish, and then you put pure water in that dish, and then you put a cell that has got some solute or electrolytes. So what's going to happen is that you have created a gradient here. So what's going to happen is that the water that is outside is going to be pulled to the inside, and the pressure inside here will increase so much that this cell will burst. So that's why it's important for a cell and to be bathed in fluid that has got more or less amount of electrolytes to prevent this thing. It's called cell lysis. Let's do the opposite. Let's say you put a dish and then you put water with solutes or electrolytes, and then you put a cell that doesn't have, it just has got pure water, and then you've got solutes here. So what's going to happen is the water that is inside here is going to start moving outside because you have created a gradient. So the water is going to move outside, and then this cell will collapse. So this is a reason why when someone has lost is dehydrated, we can't use normal tap water or water without electrolytes, because the minute you give them that tap water intravenously, that tap water is gonna, because it's pure water, is gonna enter the veins, and then go into the interstitium. But when it gets there, you're gonna have a situation where your cells have got more electrolytes than the water that you are giving. So what's going to happen is this this water is going to be pulled inside the cell, into the cell, and then you end up causing cell lysis. So that's the reason why we cannot use normal tap water or pure water intravenously. You can't even go and buy still water from spa and put it inside an IV line, or put it inside inside a evacuator. This is the reason. It's because of that bio small chemistry there. Okay, so guys, when you okay, I was talking about dehydration. So when you've got cells, these are the cells of someone who is euvolemic. This person is euvolemic. This person is euvolemic. You can see that this person has got nice round cells that are good looking. They look nice, they are beautiful, with normal pressures inside. There's no cell that is collapsed here. This person is euvolemic. Remember? So if now it happens that this person starts to have diarrhea and vomiting, or diarrhea alone or vomiting, and then they get to a point whereby significant amount of extravascular fluid has been lost through vomiting, diarrhea, or the two. Now you're gonna start to have a situation whereby the interstitial fluid is lost. The interstitial fluid is lost, and once you lose significant amount of the interstitial fluid, you start to lose intravascular intracellular fluid. This is interstitial, this is intracellular. So once you start to lose interstitial fluid, already you are going to have a situation whereby these cells, they come together. And once you lose more fluid, you start to lose intracellular fluid. These cells, they start to shrink. This is why when you pinch someone's skin, you get a reduced skin texture. Because what keeps those cells nice and round and full is the fluid. But once you lose that fluid, they start now to shrink, and that is visible when you pull their skin and you hold it for 5 seconds, and then you get a reduced skin texture. This is what is happening at the cellular level. So once now you lose a lot of fluid, significant amount of fluid, such that you start now also to lose, because now we've been talking about losing extravascular fluid. But once you start now to lose intravascular fluid, it means now you're gonna have a drop in your BP and in your pulse. And this is where we talk about shock now, or some people will talk about severe dehydration, because now you have started to lose the intravascular. So what I want you to grab from this, guys, is that when you have lost intravascular fluid, a lot of intravascular fluid, you get BP and pulse instabilities, and that's shock by definition. Once you get a low BP and a high pulse, already that's a hypovolemic shock. And this pulse, it stays there for some time, and then it also drops as well, and then it's normal. So as long as you have lost intravascular fluid only, you are just dehydrated. But once you lose intravascular as well, significant amount of the intravascular, then you are in shock. I hope you guys will appreciate that. Okay, so Okay, guys, we are gonna continue with this because it's already 20 minutes. I'm planning to have, I want us to have short videos, so I'm gonna continue with this on part 2 of this. Thank you so much.